This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Pirakon Syrup is a nootropic medication specifically designed to help with myoclonus. It works by restoring neurotransmission in the brain, aiding in the control of involuntary muscle movements. Indications and uses. This syrup is indicated for the management of myoclonus, which is characterized by sudden, involuntary muscle jerks, shakes, or spasms. It is often used in conjunction with other therapies to improve motor control and reduce the frequency of these muscle movements. Patients who experience disturbances in their brain and nervous system may benefit significantly from this treatment. How it works. The syrup acts as a derivative of the neurotransmitter gamma-aminobutyric acid, GABA, enhancing membrane stability and fluidity in the brain, leading to improved neurotransmission and controlled movements. Directions for use. Pirakon syrup should be taken strictly as prescribed by a healthcare professional. Patients must shake the bottle well before each use and measure the dose using the enclosed dosing cup. The correct dosage and duration of treatment will depend on individual factors such as age, body weight, and specific medical conditions. Regular follow-up with the prescribing doctor is essential to ensure optimal treatment outcomes. Possible side effects. Common side effects associated with this syrup include restlessness, nervousness, and weight gain. If any side effects worsen or become bothersome, it is important to consult a healthcare provider. Precautions and warnings. Before using this medication, it is imperative to discuss any existing health issues with a healthcare provider. Special caution is advised for individuals with severe kidney or liver impairment, as well as those who are pregnant or breastfeeding. Alcohol consumption should be avoided during treatment, and it is not suitable for children under 16 years of age. FAQs. 1. What is Pirakon syrup used for? It is used for managing myoclonus. 2. Can it be used in patients with kidney problems? It should not be used in severe cases, but can be used with caution otherwise. 3. How does it work? It improves neurotransmission in the brain. 4. Is it safe for pregnant women? It is not recommended unless advised by a doctor. 5. What are the side effects? Common side effects include restlessness and weight gain. Thank you for watching. If you have any questions or suggestions, please feel free to comment below. Your feedback is always appreciated.